Welcome to this Mentor Series demonstration video on converting your teaching scripts to Chalk Talks. Demonstration number 1, COVID-19 Clinical Care Primer. This video demonstrates the following strategies for learner engagement and retention. Visual aids, as well as multiple advanced/graphic organizers. Additionally, the hook demonstrated is a very simple, practical hook built around the phrase, "I want to help you, ... Please note, this Chalk Talk is meant for providers new to the care of COVID-19 patients. Let's start the talk. We have been bombarded, appropriately, with literature over the past months about COVID. There's a lot to dig through, and it's hard to figure out what is most pertinent for you as a COVID provider. I want to help you quickly know the most high-yield facts about COVID. This is the first Chalk Talk we'll do in a series of talks about caring for the patient with COVID. In this talk, we'll learn the signs and symptoms of COVID, including the most common severe complications, the timeline of decompensation, and what to monitor for daily. So, how does COVID enter the body? That's right, through the mouth or nose, either by fomite transmission or more commonly by inhaling droplets or rarely aerosols. I want you to use this knowledge as a way to remember the symptoms of COVID. If we inhale COVID, then it makes sense it can infect our entire respiratory tract from nose to lungs. And if COVID can enter our oropharynx, it makes sense it can affect our GI tract from our mouth through to our colon. Finally, symptoms of COVID also result from a massive systemic inflammatory response. All right, so go ahead and yell out some common pulmonary signs and symptoms in COVID. Great, yeah, cough, dyspnea, both with and without hypoxemia, and that's right, URI symptoms including sore throat. These are listed here in descending order of frequency, with the most common symptoms listed at the top. Cough occurs in about 80% of cases of COVID, dyspnea in about 1/3 of patients, and URI symptoms in about also 1/3 of patients. So how about some common GI symptoms? That's right, diarrhea, nausea and vomiting. Anything else? Good. Dysgeusia. That's right. And dysgeusia is often coupled with anosmia. In fact, we'll put this at the top of our list because dysgeusia and anosmia are by far more common than any other COVID GI symptom. And symptoms resulting from the systemic inflammatory response include fever, fatigue, and myalgias. All right, so now that we've reviewed the basics, most people are asymptomatic until approximately day 5. And then on day 5, we see these symptoms we previously listed. And after this point, many people do well and recover uneventfully. But about 10% of patients develop severe illness, with 5% developing critical illness. For the sake of simplicity and to aid in memory, the severe complications of COVID can be thought of as a progression of these 3 categories. Pulmonary involvement progresses to ARDS. GI involvement, including dysgeusia and nausea, both result in a lack of PO intake, which combined with diarrhea results in hypovolemia. This then results in an AKI, and if not corrected early enough, can potentially result in ATN requiring renal replacement therapy. And the massive systemic inflammatory response can actually be so severe in some patients that it can result in shock and even predispose to a hypercoagulable state, resulting in frequent DVTs and PEs, even despite DVT prophy. So, when do these severe complications tend to happen? Well, they can happen at almost any time, but notably, the median progression to ICU level care tends to occur around 10 days after symptom onset, which is day 15 on our timeline. This is a critical landmark to know, as patients may even start to feel better or seem stable during the middle of this timeline, before having an at times rapid decline near day 15 of our timeline, which is, again, day 10 after symptom onset. So, based off all this, what should you monitor? Every day, monitor subjective dyspnea, respiratory rate, and oxygen needs. And also recognize that some of these patients have worsening hypoxemia before they have dyspnea. Next, monitor PO intake, BUN, and creatinine daily, and offer supplemental nutrition early. Finally, check your patients for signs and symptoms of DVT every day, but also be cognizant that these patients can have DVTs and PEs without any evidence of lower extremity edema. In summary, COVID is a complicated disease process. A helpful way to remember its symptoms is based off where the virus has easy access to, which is the entire respiratory tract and the GI tract. And also recognizing that COVID causes a severe systemic inflammatory response. Some severe complications to monitor for include ARDS, acute kidney injury, and thrombosis. To monitor, pay close attention to respiratory status, volume status, and signs and symptoms of lower extremity DVT. In our next talk, we'll chat more about prognostic indicators, important labs, and imaging.